Hello, everyone. Welcome to the Image Wire Show. My name is Jake Fishman. I'm the host of the show and the editor of the Image Wire, and I'm excited to be joined by Dr. Geraldine McGinty, the past president of the ACR, and Morris Panner from Intelerad. We're going to be talking about image sharing and image access and its impact on patient care and health equity, which is a super important topic and something I'm really excited to share with all of you. But first of all, Dr. McGinty, Morris, welcome to the show.
Thanks for having me.
Thank you, Jake.
It's good to have you both here. I feel like a lot of the audience knows you, but even with that, I'm going to ask you to give a quick introduction to yourselves and what you do in radiology, and then we'll jump into our conversation.
After you, Dr. McGinty.
Thank you, Morris. My name is Geraldine McGinty. I am a breast imager. I served in leadership in the American College of Radiology and have a background in economics and payment policy. But I'm guessing I'm here today because one of the things that I was really passionate about in leadership was the fact that despite being the most tech-avid specialty in medicine, we were still forcing our patients to carry around outdated media so that we could get their old images. That was called Ditch the Disc. I know we're going to talk about that.
That's wonderful. And I have long followed Dr. McGinty as a leader in this area. My name is Morris Panner, and I am a software entrepreneur who is really focused on the problem that Dr. McGinty described. It is solving a technical problem, which I think, as we'll hear today, is maybe not so technical, but it's been a great industry to participate in.
Once again, it's awesome to have you both here. And I feel like I can't imagine two better people to be talking about this subject with. So I'm ready to learn a lot. Maybe to start off on that learning, just help me understand how image sharing has been done up until now. And, let's, assess that problem and maybe the progress so far.
Well, I would defer to Morris to talk about the technological advances, but honestly, too often today in 2022, when most of us don't even have a CD drive on our computer, Best Buy, I don't think even sells CDs anymore. When one of our patients needs to take their images from one doctor to another, we give them a CD. We often make them come in person to pick up that CD to expedite the transfer of those images. Again, we think of ourselves in radiology as innovators. That's kind of embarrassing.
So to echo Dr. McGinty, I actually got into this because I experienced as a parent and a parent of a patient this exact problem where I was trying to get a second opinion for my son. He was a little tyke and he's now a big tyke and he's fine. But at the time, there was really no good way to move information around other than to carry it around on a CD, and that just didn't feel right to me.
From our conversation and from things I've read from you and other people in the industry, I see that this is a problem, and I hear different people talk about it, but I wonder whether, the average radiologist or average radiology team member, while they're doing their day-to-day, and maybe not necessarily have a full understanding of what's happening outside of their department or at the hospital next door or, their peers within their department, do they realize how big of a problem this is?
Well, look, I don't think any radiologist is proud of the fact that we're making people carry around CDs in 2022, but radiologists are working harder than ever. They don't have a direct line to the CIO. Even if they were to call the CIO and say, you need to stop this, as I said, there are other major issues. So I don't think we can blame those individual radiologists, but I'm pretty sure all of them don't think we should be doing this anymore.
Just to echo Dr. McGinty, one of the things that I think you see is that increasing pressure on the radiologist. It's overwhelming. And the other specialties maybe feel it even more. So if you're a surgeon and you're trying to get access to imaging, you can be extremely frustrated. And when a patient can't provide a prior study, sometimes you're not even 100% sure whether what you're looking at is a difference from a previous condition. So I think the whole system feels the pressure, but everybody, maybe as Dr. McGinty says, feels, I don't know if powerless is the right word, but they don't maybe feel they have the direct line they need.
And look, sometimes it takes an emergency or a crisis. Our offices were full of paper. How many forms did we all fill out? Then the pandemic came and we stopped that immediately. So sometimes we have to really be pushed.
And Dr. McGinty, just to give you a stat to back that up, although image sharing is still probably not where we want it, we saw volumes triple during the pandemic, because for the first time in my lifetime, I saw hospitals literally close their physical doors and say that we're not going to allow people to come here because of the fear of infection. So unless you can provide us information electronically, we're unable to help you. And that was a sobering moment, I think, for everybody. And it really brought home the importance of this kind of access.
So how does this impact patient care and health equity?
It's a great question. So I'm a breast imager, and honestly, one of the most powerful tools I have when I read a mammogram is the prior mammograms. You know, seeing a subtle change is what potentially allows me to make the diagnosis of breast cancer when it's early and curable. And when we think about patients who haven't had maybe great access to health insurance or care, adding to them the stress of then trying to go back to a facility to find that old imaging really disadvantages them, I think, and makes me unable to give them the very best care, which is what I always want to give.
And Dr. McGinty, you make a really important point, which is these technology issues often have very broad social implications. And one of the things that I've been excited about is watching your and other leaders' work in Radiology, because that's been an organization that has elevated a lot of this conversation and made it more accessible. It's a place where I think people can kind of go and learn and be a little bit vulnerable, and maybe at the end of that bring something back to their institution, which maybe they weren't sensitive about. And I think some of the awareness that you have brought about, even in this interview, I'm not sure everyone's thinking that way, and I think they should. So Radiology has been a great driver of that kind of change.
Well, we've been very grateful for Intelerad sponsorship of that. But I think that, an important point about it, as you say, is it brings together developers, technologists, physicians, and that diversity of viewpoint, I think, is what we need when we're trying to solve difficult issues like this.
So we have these macro trends that are happening in healthcare. And one of those, or I guess maybe one of the results of those, is consolidation both on the provider side and then changes and consolidation on the vendor side. How is this driving changes or not driving changes in this patient access issue?
Well, maybe, Morris, I can jump in. And another initiative that I was part of at the American College of Radiology was something we called Imaging 3.0. And my friend and colleague, Jim Rawson, coined our why on that as being, we need to stop thinking about delivery of healthcare from our perspective as physicians, equipment vendors, health systems. We need to think about it from the patient's perspective. As he said, it's hard to put the patient in the center if you're still there yourself. So I think that, maybe it's a broad comment on everything that's happening in healthcare. I think too often we don't necessarily put the patient's perspective first and think about the experience of care through their lens.
Dr. McGinty, I think that's spot on. And one of the things that I think we are starting to see in healthcare is the consolidation of information and expertise. And one of the things that makes that so exciting from a patient point of view is you can almost touch the massive improvements that we're seeing. You see these incredible developments in therapy, this concentration and interchange of ideas. So as a patient, how do you access that? And how do you access that no matter where you are or who you are? And that is part of, I think, the fundamental notion of making imaging more accessible, because it's one of those data types that is not very subjective at the end of the day. I mean, you can have some subjective interpretations around it, and that's where experts get involved. But at the end of the day, this kind of incredible ability to image and see inside of the human body opens up a real revolution in care. And I think the mission is to make that more accessible.
So one of the things that I hear about, I guess, helping make imaging more accessible are these imaging exchanges and the idea of interoperability of the image exchanges. Maybe to start us off, can you just help us understand, what that means and how that works right now?
I'm going to defer to Morris on that one.
So Dr. McGinty, I think this is one where there's a lot of almost cross currents between the vendor community and the provider community and the patient community, where there's sometimes some finger pointing. And I think just to take some responsibility as the vendor side, are the vendors who provide imaging exchange networks doing everything they can to interoperate. You don't want a image exchange network like the old phone network where Verizon couldn't call AT&T, or you couldn't use your credit card in a restaurant unless you had the right one. You really want it to be seamless the way those networks are. And we haven't gotten there yet. But I think right now, the pressure is to make that experience seamless. So providers will share with each other, the vendors will interoperate with each other. And that big vision, I think, is what we're pushing for as an industry. And what makes today particularly exciting, because I think that's where you're seeing investment, that's where you're seeing focus. And that's, I think, what is so energizing.
I would just jump in and say I'm old enough to remember pre-DICOM radiology. We have managed to do this before. There was a time when you couldn't see images from one machine on another. We found it in ourselves to move that one forward. So I really think we have to keep pushing on this.
That's a great analogy, because one of the things that radiology has done is innovated technically in a way that very few other parts of the healthcare profession really have. That DICOM standard, although not the newest technology, is extremely powerful. It makes it possible to share information across any system. And that is something we need to hang on to, grab onto, and really push, I think.
So for this goal, I mean, it seems like, so we have like the tools, and obviously we have the need and desire. What are the current barriers for actually achieving that goal, both from a patient perspective and a provider perspective?
Well, I just wrote an editorial for the Journal of Diagnostic Imaging, and I think they're numerous. They start with a radiologist who's got, tight turnaround requirements for reporting. Those are laudable. But, the impetus to then track down the old films, get them, put the exam on hold, not there, right? Honestly, I think large health systems have also had an incentive to not make it so easy for patients to go elsewhere for their care, even though, especially for, university or specialty hospitals, many of your patients are coming from outside. So it's going to generate more volume for you and be important for the ability to deliver better care. And I think the regulatory environment has been a bit, frankly, lukewarm on actually enforcing this. Sometimes it takes that regulatory hammer to actually move us off our inertia. So unfortunately, I see a lot of barriers, but not insurmountable by any stretch of the imagination.
I would call out, and Dr. McGinty, I thought that editorial was very important. And the Journal of Diagnostic Imaging, I love that publication. And I think one of the things that is so noteworthy about it is it has some of the most sophisticated discussions in the profession. And this issue really zeroed in on this issue, which I think shows how important it is to the profession and how we're starting to gather some critical steam, whether it's the RSNA or SIM or the ACR. Dr. McGinty at the ACR made this one of the signature issues. So I think there's sometimes a question of will. In other words, you can see if everyone, it's not that we need to solve complicated equations here. We know the answer. We just now need to live our commitments. And that's what I think is so inspiring to see the profession dedicate something like a whole issue of the Journal of Diagnostic Imaging to this very important topic.
So say a hospital system decided to just go out and officially ditch the disc. What are the types of things that they would have to do to get to that point?
Well, I can start. And Dr. McGinty will know probably better than I because of her background in various care settings. But I think at some level, there is an easy way right now to image enable these modalities. And you can either burn a CD, which is, I think, what was happening predominantly 5 years ago. That's fine. But since no one has a CD player or burner anymore, it makes sense to have something different. So now you literally are able to kind of think about it almost as a Dropbox or any kind of digital repository for imaging. And there's a lot of solutions that you can think about. I have my own preferences, of course, but the nice thing about this is it's accessible in the marketplace today. So when you visit RSNA or when you're thinking at your SIM or any of the shows, there really are product solutions to think about that start to architect a solution from PACS, combining with the electronic medical record so that you really can ditch the disc and make it part of the workflow if you're willing to invest in that kind of thought process. It's out there and accessible if you're willing to seek it. I don't know if you agree with that, Dr. McGinty, but I think it's available.
I think, and I'm not an expert in the technology, but I would certainly agree, we have ways of doing this that are, very seamless and simple compared to the whole CD process, certainly from the patient's point of view. It's challenging, isn't it, to think about running the informatics or IT aspect of a hospital, cyber attacks, keeping the electronic health record running, the pandemic staffing. So I think, we really have to be presenting solutions to ourselves, or the industry has to present to us solutions that, feel easy, feel, so that they, again, will overcome the inertia, because often I'm afraid in healthcare, we put up with less than ideal because it's what we have, and we just, aren't able to move past that.
And, Dr. McGinty, I think you make a great point that I kind of want to underscore. One of the stresses right now in the system is there is a real push for entrepreneurship in healthcare. Digital health numbers, although uneven in certain areas, particularly in enterprise technology, are continuing to go up. And one of the things that is hard is, as an entrepreneur, we have a mandate, which is move fast and break things. And physicians generally, if I see my physician, I like the Hippocratic Oath more, because if I hear from the physician, if she says to me, I am going to move fast and break things, I probably go see somebody else. So how do you marry those two things up so that you end up with an innovation culture within an environment that respects patients and understands there's a family and a person behind every one of these interactions? That, I think, is something, I think you put it very well, Dr. McGinty. How do you operate in that environment? It's not as simple as just throwing something out there and saying, let's give this a shot. But I do think there is an opportunity for collaboration. It's probably what makes this one of the most interesting areas of innovation right now.
I have to agree that this is one of those areas that brings people and technology and organizations together, because inherently that's how it's designed. And I think that's really neat. And the cool part is there's people watching this right now who are from various organizations and technologies and roles who really, if they're going to bring this into their own organization or to their clients' organizations or their, regional partner organizations, they're going to have to do that too. So to the folks who are watching, I hope you pick some of this stuff up. The information that Dr. McGinty's been putting out and continues to put out around the need and how to ditch disc and improve your access is out there. I'd encourage you to check it out. And the things that Morris is doing with Intelerad and bringing together a true network of open image exchanges is really changing the way that images are shared and transferred across America and beyond, which is amazing too. So I'd encourage you to check that out too. Morris and Dr. McGinty, thank you for coming in.
Thank you.
Thank you, Jake. And thank you, Dr. McGinty. This was a lot of fun.
So it was a conversation I like having.
Yeah.
All right. Thanks for watching, everyone.